dancing for us.
So we are 1 year out from a lower body lift, a high definition lower body lift. She's working out, and I'm not gonna say anything.
She's just gonna pose.
People stop me wherever I'm at. Oh, you look like a fitness model. You look so good. Yada yada. What do you do?
Yeah.
Here's my surgeon. Eat this.
Thank you.
Eat that. Right? I mean,
Yeah.
it's I have to do my part so you can do your part.
Exactly. That's what I always say. It's a team effort. I did the surgery, and not only you have to recover, but you have to maintain it.
Yeah.
And if you don't maintain it and gain weight or lose weight, you can actually affect the results.
You can undo everything.
You can undo everything within a few weeks after surgery.
Yes. Well, I mean, even people that have had
Yeah.
tummy tuck, they don't, just because they had skin removed doesn't mean they're gonna.
Not gain the weight back.
Yes.
Yeah. And for those who think body lifts are only for weight loss patients, no, it's not. Body lifts is for anyone who wants to regain their shape and to contour their abdomen, their backside, and their thighs. And she's just an example of that, and she looks phenomenal, to say the least. And obviously she's working out, which is really the best way to maintain what we have done for her. I love you. You're so cute.
You're gonna make me cry. Without you, none of this would have been achievable. So not bad for 54, huh?
You look amazing.
Thank you.
Seriously.
Thank you so much.
Today I have the privilege of seeing one of my patients who's been with me for about 13 years. Initially, she had breast augmentation and lift and a tummy tuck in 2004 or 5 or thereabout, and that was done elsewhere by another surgeon. And then over the course of many years, she had lost 80 pounds of weight at that time. We did a thigh plastic, which is this vertical incision. This was done in 2012, and in 2014 we ended up doing a lower body lift on her. When she had her lower body lift, she weighed around 170 pounds. In the past 3 years, she's lost another 50 to 60 pounds of weight by working out. You can just see her beautiful abs. And despite that tremendous amount of weight loss, you can see how beautifully she's retained and maintained her lower body lift. These are her scars. I've covered her tattoos because she wishes to be very private.
What a good butt.
What a good butt, Chelsea says. Look at her butt. Despite, again, she's lost 50 pounds from 2020 onwards. And despite that, she has not lost her butt because we did a flap augmentation and fat transfer. She's maintained all of her results. You're one of our favorite patients. She has been in and out of our office for the past 2 years. You've seen her without her showing her face ever, but today is willing to share her experience with you. In 2021, we did a lower body lift on her. She's not a weight loss patient, but she wanted her abdominal contour, outer thighs, front of thighs, buttocks, everything improved. So to get all of that done, you have to do a body lift because the body lift is the only procedure that offers correction of the tummy, the front of the thighs, the outer thighs, the waist, the lower back, and the butt at the same time. And that's what we did for her. Why didn't you turn for us?
Look at that butt.
Look at that buttocks.
That's so good.
So beautiful, right? Let me show them a little bit of your scars. So this is her scars. No pain, no gain. This is all
It's all you, doctor.
us.
Gym.
No gym. She has no time for gym. So this is the result of her high definition. Look how beautiful that scar looks. And as you know, we spend a lot of time, Chelsea can tell you, I have OCD, so I spend a lot of time making sure all the incisions are symmetrical, so that we end up with patients being happy with beautiful low-cut incisions and these scars remarkably heal well if you follow our instructions. Was it worth it?
Absolutely. Absolutely.
Do you love your body?
I do. I wouldn't.
Wouldn't. Exactly. So for those who think body lifts are only for weight loss patients, I mean, it's just another example of why we do body lifts. You know, body lifts accomplish a lot. They are transformative. We can achieve a lot through these procedures and obviously change patients' lives. Have you changed your life?
Absolutely.
Really?
Yes.
She is beautiful. She had a lower body lift and thigh surgeries by us. Her lower body lift is 1 year out, and then her spiral thigh lift, which is one of my own pioneer procedure, is about 6 months out. She did a lower body lift not because she had lost weight. It's really rejuvenation, restoration of her younger body, and that's exactly why we did it, and she looks phenomenal. Let's start with the front. Okay, my high definition tummy tuck, pubic lift. We lifted the whole thigh unit, the front, the inner aspect, the outer aspect, the back. We also did a limited vertical thigh-plasty, small incision on the inner aspect of her thigh to really go after the upper inner thigh fullness. The lower body lift and this were done a year ago. The spiral thigh lift, which is an inner thigh lift coming underneath the butt, was done 6 months ago. Look at her beautiful buttocks that we recreated for her, and we did buttock lift and buttock enhancement and reshaping, and you can appreciate how beautiful they look. Again, this is a limited vertical thigh plasty, but what I want to show you is the spiral thigh lift incision. You see? This incision is placed at the infragluteal crease. She had a fold of skin here that really found bothersome. So we elevated the back of the thighs towards the ischial tuberosity, which is a bony prominence here. We reconstructed her infragluteal crease. Infra means lower, gluteal means the butt. So the crease that goes underneath the butt, removing a wedge of skin, banana rolls from this, and then we continued with that incision on the inner aspect of her thigh, essentially her groin crease, and reconstructed that at a higher position. This surgery is one of the hardest plastic surgery procedures. What you want to do is to do an effective, comprehensive inner thigh lift with lots of anchoring sutures so that this scar does not migrate.
Thank you so very much.
You're welcome. Following up on our patient, she's 90 days from this, and I can tell you her buttocks look phenomenal, amazing, gorgeous. They're so, right?
Yes.
So I'm really grateful that she's come all the way back from Washington for her follow-up. This is the only way that I can actually see patients. More than half of our patients come from out of town. It looks amazing, and she's healing beautifully. This is her scar, and she was just telling me that, you know, how invisible these scars are. And let me just pull it down if you don't mind for a second. See how perfectly they are placed? This was correction after liposuction elsewhere. She ended up with skin laxity of her thighs and her buttocks. So we ended up doing a buttock lift, buttock reshaping. We liposuctioned her, did liposculpting, put some of the fat into the buttocks to create these beautiful buttocks, and then an outer thigh lift. And actually we ended up doing not only an outer thigh lift, but also we lifted the front of her thighs and an inner thigh lift. She had had a prior tummy tuck done elsewhere. I brought her incision lower in the front, cleaned her tummy tuck incision, and then performed an inner thigh lift. So her inner thigh incision is perfectly placed. And then by the virtue of doing this correctly, meaning that you want to put the inner thigh tissue behind the pubic fat, she still has fullness. A lot of times I see these surgeries done incorrectly, and essentially the pubic area and the thigh skin have been sutured like this, so there is no indentation in between. What you want is the pubic area sitting over the thigh skin like this. You want to have that fullness, and we preserve that for her, and her incisions are perfectly placed. What do you think?
I'm very pleased with the results. I'm very pleased that I came here.
Thank you. Our beautiful patient is here for follow-up. She lives in Arizona. 8 months ago, I did a lower body lift on her. And as you can appreciate, she's not a big person. She's not somebody who's lost a lot of weight. We also did an inner thigh lift. So the question is, why would you do this big surgery?
I work out a lot, I'm very athletic, and my skin from just, I think, hereditary was very loose. And to be honest with you, I just couldn't look at myself in the mirror every day and feel that way, knowing that I wasn't happy with all the hard work I put in to get to see yourself like that all the time. So it was worth every second of pain and any little things I had to come to the best to get it done, because the result is amazing.
Thank you. So we did obviously our high definition tummy tuck. Look at her beautiful abdominal contour, pubic lift, thigh front lift, outer thigh lift, inner thigh lift. So look at this groin incision, guys. Look, it's there, okay? And I can't show you more than that. But you see how the groin indentation has been perfectly reconstructed, and the pubic area is actually correctly sitting over the groin. That's the way it's meant to be done. A lot of times I see surgeons suturing the skin of the upper thigh to the mons area, and you lose that beautiful indentation, which you're not meant to. The pubic area then spreads to the upper thigh, and then you get labial spreading. Correctly placed, and that has to do with the technique of doing it correctly. And let's look at your backside. We did an outer thigh lift, and then we did a buttock lift and buttock augmentation with all the little fat and tissue that we had. We did flaps, so these are her flaps, you can see it. These were taken from here and rotated in. Yeah, and this is the other side. And you see, this is the white scar of the incision. The redness is gonna fade. She's gonna end up with a beautiful white line ultimately, just like her front. So we are seeing one of our patients. She's back from Florida for a follow-up. We did a lower body lift and breast implant exchange. The lower body lift obviously included a tummy tuck, pubic lift, thigh lift, buttock lift, liposuction, and buttock enhancement. How long has it been?
It has been almost exactly 9 months.
What do you think?
I'm so thrilled, can I tell you? It's been a wonderful journey, and I've enjoyed working with you so much. You've been such a attention to detail, and very kind and very warm and very abrasive in my insecurities and the things that I needed and wanted fixed.
Thank you. I truly appreciate that. And look how beautiful this abdomen looks. Beautifully defined. And then I'm gonna rotate her. We didn't have a ton of fat to work with, but we used what we had, and she's got a nice buttock shape, fullness, roundness, smaller, but still beautiful. Size is not the most important factor, it's the shape and the definition and projection, and she has all of that.
I do, very happy, thank you.
You're welcome.
Everyone was like, damn, that girl looks good. I was wearing a bikini, like a little bikini. It was awesome.
Okay, here she is, almost a year out. We did a lower body lift on her with tummy tuck revision, pubic lift, front of thigh lift, outer thigh lift, waist reduction, lower back skin excision, buttock lift, liposculpting, and fat transfer to her buttocks. I mean, just look at how low that scar is and how beautifully it's healed. And look at that scar on the back. I'm pulling her thongs down, and look at her buttock shape. So normally if you wear your bikini here or your thong here, then it will perfectly hide your scar, and you get a beautiful, correct buttock shape. This scar kind of determines the upper margin of the butt when I do the surgery, and you see that the scar kind of delineates a round buttock shape, which is what we want, placed correctly between the lower back and the upper buttocks. And as we rotate her, she's got a nice beautiful fullness. Her thighs are tight,
As I say, you retain about 80% of the correction after the surgery once everything settles and the tissues kind of come back to their place and the sutures are dissolved and so forth. And that's exactly what we have today. The surgery gives you 100% correction on the day of surgery, but you retain about 80% of it afterwards. And look at her abdomen. She's been in the gym every day. Not.
So not.